It's the middle of the night and you're deep in dreamland. Suddenly a jolt of agony hits you like a bolt of lightning right where you least expect it, your rectum. It's sharp, it's stabbing, and so intense it feels like you're being impaled from the inside out. You can't move, you can't breathe, and honestly, death sounds like a sweet release. It's called Proctalgia fugax, a rare and extremely painful disease. And here is the kicker. It's not even close to the most painful one we're going to tell you about on today's episode of The Infographic Show. Disease is so painful, you'd rather die. So brace yourself and pray you stay healthy. Number 10. Stoneman Syndrome. We've all taken a hit to the elbow or bumped a knee, but for people with Stoneman Syndrome, these minor bangs come with more than a little bruising. They are a life sentence of unimaginable pain. Officially known as fibrodysplasia ossificans progressiva, this ultra-rare disease causes your muscles and connective tissues to ossify. It literally turns your body to bone, one painful inch at a time. Here's how it works. You injure yourself, maybe just a little, but then the muscle tissue around the injury begins to harden, and it just gets worse. Every bump, bruise, or even a medical procedure can set off a chain reaction where your soft tissues throughout your body calcify, trapping you in a prison of bone. Over time, your joints lock up, your body contorts, and the simplest movements become impossible. Just trying to lift your arm or turn your head can feel like a crushing weight on your bones. Even breathing can become difficult as your rib cage begins to ossify. And unlike some other rare conditions, there is no treatment to stop it. You are stuck, piece by agonizing piece, as you slowly become a living statue. This next entry on our list is a killer that hits fast. So if you thought Stoneman Syndrome sounded painful, we're only just getting started. Number 9. Butterfly disease. We all know what it's like to get blisters from a new pair of sneakers, but for people with epidermolysis bullosa or EB, every day is a never-ending battle against their own skin. Nicknamed the butterfly disease, EB is a rare genetic condition where even the gentlest touch can tear skin, leaving open wounds and blisters in its wake. Just imagine that your skin is as fragile as tissue paper. Any slight friction, like putting on a shirt or even moving, can cause your skin to shear off, exposing the raw flesh beneath. This isn't just on the outside either. Inside your mouth, down your throat, even in your eyes, blisters can form. It makes the most horrific basic functions of life excruciating. Eating, drinking, and even blinking can turn into horrific ordeals. The constant cycle of blistering and healing leaves behind scars that fuse fingers and toes together, stiffening joints and deforming limbs. Infection is a constant threat, as every new wound is a gateway for bacteria to enter. Pain management becomes an endless routine of bandaging and medication. There is no cure, just a daily fight against a body that refuses to protect itself. And it doesn't get any easier from here. If you thought living in a constant state of pain sounded unbearable, just wait until you hear about our next condition. Number 8. Postthe Neuralgia. We're not done with horrifying skin diseases yet. This one makes your skin so sensitive that even a gentle breeze can feel like a burning piece of metal being pressed against your skin. Postthe Neuralgia, or PHN, is like your nerves getting PTSD from a bad shingles breakup. It's caused by the varicella zoster virus, the same chickenpox virus you had as a kid. And now it's back for round 2, and the sequels are always bigger and badder. PHN attacks the nerves, leaving you with a deep aching pain that can last for months or even years after the rash is gone. Everyday sensations like your clothes brushing against your skin or a light hug can trigger intense stabbing pain. It's as if your nerves are wired to a live electrical current, firing off jolts of agony at the slightest provocation. It's more common in people over 60, but anyone who's had shingles is at risk. Treatment is tricky. While some medications can dull the pain, there is no cure. The nerves are damaged and they are not quick to heal, so sufferers are often left to manage the almost non-stop burning and stabbing on their own, knowing that there is no easy end in sight. Number 7. Osteosarcoma. The good news about osteosarcoma, better known as bone cancer, is that it's rare. The bad news? When it hits, the pain can be beyond description, and it is relentless. Osteosarcoma often targets the arms and legs. It starts as a deep, dull ache, but as the tumor grows, so does the pain. Eventually, it feels like your bones are being crushed from the inside out. Movement makes it worse, but even sitting still doesn't bring relief. And unlike with other types of pain, there is no position that makes it better. Osteosarcoma pain is caused by the tumor pressing on the nerves and muscles, breaking down the very structure of the bone. It's often described as a constant throbbing ache, but it can spike suddenly, like someone driving a hot stake right through your limb. For those unlucky enough to have it spread to multiple areas, it's a 24/7 pain apocalypse. Doctors can try to manage it with painkillers, but there is no easy fix. Surgery, radiation, and chemotherapy are often the only options, and even then the pain is persistent. Osteosarcoma is a reminder that cancer doesn't just kill. It can make every moment a living hell. Number 6. Stiff Person Syndrome. Stiff Person Syndrome, or SPS, is a rare neurological disorder that does a lot more than make you a little inflexible. Caused by an autoimmune attack on the central nervous system, this disease locks your muscles into rigid spasms. These can be so severe they can cause fractures. Living with this condition means a constant battle against a body that can freeze up at any moment. There's virtually no warning that you develop the disease either. One day your muscles begin to stiffen uncontrollably, and soon, even the simplest movements can trigger a full body spasm. These aren't your typical muscle cramps. They are extreme contractions that can twist limbs, lock joints, and leave you writhing in pain. The spasms can be triggered by something as minor as a loud noise, a light touch, or even an emotional response. Once they start, there is little you can do except ride it out. You're trapped in your own body. The condition is rare, but when it strikes, it is life-changing. Many people end up unable to walk or even sit comfortably, relying on powerful muscle relaxants just to get through the day. Stiff Person Syndrome makes ordinary life feel like a minefield, where any unexpected movement could send you into agonizing spasms. Number 5. Arachnoiditis. Think about the worst back pain you've ever had. We're talking about the kind that makes it hard to stand up straight or even breathe without wincing. Now imagine that pain taking over your entire spine, radiating out in fiery electric waves. That's arachnoiditis, an excruciating condition where the protective lining around the spinal cord becomes inflamed. And it doesn't just stop there. Arachnoiditis often starts with trauma to the spine, maybe a surgery gone wrong, a bad spinal injection, or even a severe injury. But the pain doesn't just stay at the site of the injury. It spreads, causing nerve roots in your spinal cord to stick together. This creates a tangled web of nerves that misfire constantly. They send a stabbing, burning pain throughout your back, legs, and sometimes even up your arms, and can range from sharp shocks to a constant searing ache that doesn't ease up. It can affect your entire lower body. You might feel like you're walking on broken glass or like your muscles are being torn apart. And if you think painkillers will help, think again. The tangled nerves are so hypersensitive that most treatments barely make a dent, leaving you in a state of constant torment. Arachnoiditis makes you question every movement, every step, every twist of your body. It's a cruel reminder that sometimes the pain doesn't fade away. But even with all that, the next condition on our list might make arachnoiditis feel like a walk in the park. Number 4. End-stage pancreatic cancer. Pancreatic cancer is already one of the worst cancer diagnoses you can get, but end-stage pancreatic cancer takes suffering to almost unimaginable depths. This isn't just about a terminal illness, it's about pain that digs deep, gnawing at you from the inside out as the cancer spreads and takes over. As the tumor grows, it presses on your nerves, muscles, and surrounding organs, sending waves of searing, stabbing pain throughout your abdomen and into your back. It's not the kind of pain that ebbs and flows. It's a constant grinding ache that feels like a clamp squeezing your insides. You can't sit, you can't lie down, and even breathing can be excruciating. Worse yet, this pain isn't something you can easily medicate away. The tumors often block critical pathways, causing nausea, vomiting, and intense discomfort every time you try to eat. As your body starts breaking down, the pain only intensifies, spreading and radiating in ways that make it feel like there is no escape. If the physical pain wasn't bad enough, there's also the huge mental toll. Every day brings more suffering and less relief. Painkillers can dull the agony, but they never truly make it go away. End-stage pancreatic cancer doesn't just rob you of time, it strips away every comfort, making each moment a harrowing countdown. If you think that sounds unbearable, we're only scratching the surface. We've reached the top 3 in our list, which brings us to a whole new level of pain and misery. Number 3. Complex Regional Pain Syndrome. Complex Regional Pain Syndrome, or CRPS, sounds like it could be just another uncomfortable condition, but for those who suffer from it, it's anything but simple. Like many of the diseases on our list, CRPS starts with an injury. often something minor like a sprained ankle or a small fracture. But instead of healing, the affected area erupts into a world of unceasing burning pain that only gets worse with time. And the pain isn't limited to the site of the injury. It radiates outward, spreading through your limb like a wildfire. The skin becomes so sensitive that the touch of a feather can feel like a blowtorch against your skin. Your joints stiffen, your muscles weaken, and soon you're left with a limb that feels like it's being crushed and burned from the inside out. Over time, the symptoms get worse. The skin around your injury changes color, becoming red or purple, and your hair and nails start to grow abnormally fast. Eventually, the affected limb can become almost useless, twisted and locked into place by excruciating spasms, and the pain can spread to other parts of the body, seemingly attacking at random and making everyday life torture. Recently, a young Australian girl's infected blister led to a serious case of CRPS. It turned into agonizing leg pain. She couldn't walk. She couldn't even wear clothes over the infected leg. Doctors aren't entirely sure why CRPS happens, and treatments are often only partially effective, leaving many sufferers trapped in a cycle of pain that never seems to end. The good news is, for most people, the pain is significantly reduced within a year. It'll just be the worst year of your entire life. But if you think CRPS sounds brutal, the next entry on our list takes pain to a level you wouldn't believe. Number 2. Cluster headaches. Cluster headaches are often described as the worst diagnosis you can receive. Once you hear what they're like, you'll understand why. A cluster headache is a brutal assault on your senses that is so severe it feels like someone is drilling through your skull right behind your eye. It can happen multiple times a day, every day, for weeks or even months. The pain arrives suddenly and without warning, and it doesn't build slowly. It slams into you like a freight train. Within minutes, the area around one eye becomes swollen, red, and teary, while a burning stabbing sensation spreads through your face and down your neck. The attack can last anywhere from 15 minutes to 3 hours, but the relief is short-lived. Another one could be lurking around the corner. Sufferers often find themselves writhing, pacing, or even banging their heads against a wall, desperate for anything that might lessen the agony. Cluster headaches don't just come and go. As the name suggests, they strike in clusters, often hitting you like clockwork around the same time each day. And because the pain is so intense, many people live in fear of the next cycle, knowing it could turn their lives upside down for weeks or even months at a time. Cluster headaches will make you rethink everything you thought you knew about pain. But even as brutal as these can be, this last condition on our list will have you wishing for anything but what it brings. Number 1. Trigeminal neuralgia. Trigeminal neuralgia might sound like a rare and obscure condition, but for those who live with it, it is a living nightmare with a name. It attacks the trigeminal nerve in your face, delivering bolts of excruciating pain that can strike at any moment. Even simple actions like talking, eating, or brushing your teeth can set off a searing jolt that feels like an electric shock slicing through your head. Here's what makes it truly terrifying. The pain doesn't last long, just a few seconds to a couple of minutes. That doesn't sound so bad, right? The truly horrifying part is that it can happen dozens of times in a single day. It's a relentless assault that leaves you constantly on edge, never knowing when the next attack will strike. Some sufferers have compared it to being stabbed in the face over and over. Others say it feels like their teeth are being shattered or their skin is being torn apart. One woman described it as if someone was thrusting a knife in my face, pulling it out and doing it again and again. While another said it was like a sudden, excruciating tooth pain, like having my molars split by a dull chisel. The pain can be so intense that many people become afraid to move or even smile. Even a facial muscle movement could trigger another episode. Unfortunately, treatment options are limited. While medications can sometimes dull the pain, they don't always work, and surgery is often a last resort with no guarantee of relief. About 150,000 Americans receive a trigeminal neuralgia diagnosis every year, with most cases developing after the age of 50. And once diagnosed, they will spend their waking seconds waiting for the next horrifying attack to happen. Which of these do you think would be the most terrifying? Let us know in the comments. Now you need to watch Most Painful Way to Die, Nerve Agents, or check out Freak MRI Accident, Worst Ways to Die.